Hello students. Welcome to chapter 22, Surgery and Nutrition Support. This is the chapter for those of you who wants to work in a hospital. This is the chapter that is going to clarify, give you a lot of guidelines and protocols in advance before you enter the hospital. You're going to understand many things that is going to be explained in this chapter besides the gastrointestinal part and the burns, because we're going to talk about those topics. So, surgical procedures may require nutrition support for tissue healing and recovery. Here we're going to talk about your IVs, your parental, your enteral nutrition, your hypotonic, your lactate ringers, fluids that are going to be administered in the hospital. This is a very important chapter. Gastrointestinal surgery may necessitate diet modifications if the surgery alters the normal digestion or passage of food. To ensure optimal nutrition for post-surgical or critically ill patients, diet management may involve enteral or parental nutrition support. So when we say enteral, we are talking about the bowels, right? Gastroenterology, enteral, is related to the small bowel or the large bowel, right? Enteral. Parental is related to nutrition that is going to be given through IV, through certain important veins, okay? So effective nutrition support should reverse malnutrition, improve prognosis, and speed recovery in a cost-effective manner. The chapter looks at the nutrition needs for surgical clients, burns patients, and the enteral and parental feeding methods for providing nutrition support. Careful attention to both preoperative and postoperative nutrition support can reduce complications and supply essential nutrients resources necessary for healing and health. So this is an NCLEX alert. Anything related to safety, anything related to preoperative and postoperative is coming in NCLEX. And you must pay attention because you're going to be tested on that. Let's start. Nutrition needs for general surgery patients, right? Your med-surg patients, those in med-surg units that are scheduled for surgery, or they are coming back to the unit. They are coming back to the unit after the surgery, post-surgery patients. A client undergoing surgery often faces significant physical and psychological stress. As a result, the body requires more nutrients during this period, and deficiencies can develop that manifest as malnutrition with subsequent clinical complications. You can have an overweight or obese patient that is having malnutrition because the nutrients are not the right ones, right? That's why he's having this inflammation. Overweight and obesity is an inflammation state of the body. So poor nutrition status and the following clinical problems are well documented: impaired wound healing, increased necessity of enteral or parental, longer hospital stays, increased morbidity and mortality rate, and reduced quality of life. And the diagnosis of malnutrition includes the following general characteristics: insufficient energy intake, means poor carbs maybe that does not provide good energy, like simple carbs. Weight loss, loss of muscle mass, here, there you go, loss of muscle mass, there you go, you're elderly, okay, people that are losing weight without unintentional weight loss, loss of subcutaneous fat, right? Localized or generalized fluid accumulation because lack of protein that causes edema, and diminished functional status as measured by strength and hand grip. A diagnosis requires that a patient meet 2 or more of these criteria, and that's good to know. This criteria is very important. Preoperative nutritional care, nutrient reserves, When clients have elective surgery that are not an emergency, right? They have time to prepare beforehand for the nutrient demands of the surgery and the period of limited food intake, right? So these are type of surgeries that we schedule, right? For example, um, I don't know, maybe a laparoscopy for something, right? It's not an emergency. It's not a trauma. It's not a surgery related to a trauma. Okay, protein, for example. Every surgical patient should be equipped with adequate body protein to counteract blood that is lost during surgery and prevent tissue catabolism during the immediate post-operative period, right? And the adequate dietary consumption of high quality complete proteins, that are those that have all the essential amino acids, improves the body ability to maintain lean tissue. Dr. Matalana, you are talking difficult now. What are amino acids? So I put it here. Amino acids are organic compounds composed mainly of nitrogen, carbon, hydrogen, and oxygen. Okay, your body needs 20 amino acids to grow and function properly. While all 20 of these are important for your health, only 9 are classified as essential. So 9 essential amino acids, you are not going to be tested, but you need to know, right? The proteins are going to be crucial for your health if they contain the 9 essential amino acids like histidine, isoleucine, leucine, lysine, methionine, and those difficult names that you are reading here, okay? Although your body can make non-essential amino acids, it cannot make essential ones, so you have to get them through the diet, okay? And the best sources for these essential amino acids are animal proteins, such as meat, good quality of meat, eggs, and poultry. However, some plant foods, such as the soy that is not genetically modified, like edamame, tofu, contains all 9 essential amino acids. This means that they are complete protein sources. So tofu, these animal proteins, right? Tofu, soy, edamame, they have essential amino acids. If you go, for example, to Trader Joe's, the people that goes to Trader Joe's, they are very educated about good food. That's why it's very difficult to find in the store edamame. They fight for edamame and good organic tofu. Go and start observing the habits of the people in different supermarkets. If you go, for example, to Trade Fair, Key Food, especially in the Latino area, you're going to see people are going out with the shopping carts full of proteins that are not organic. They are buying a lot of meat, a lot of pork, a lot of, right, chicken that are not organic. The meat they buy, they are not grass fed. So if you go to Trader Joe's, for example, you're going to see the difference in the shopping carts. They have organic tofu, organic edamame, a lot of vegetables. It's totally different. It's something that you need to start observing and learning, okay? So enteral, we spoke about a mode of feeding that makes use of the gastrointestinal tract through oral or tube feedings. Parental, a mode of feeding that does not involve the gastrointestinal, but that instead provides nutrition support via the intravenous delivery or nutrient solutions. Okay, so now the clinical diagnostic criteria for malnutrition, we have 3 different columns, right? Acute illness, chronic disease related malnutrition, and social or environmental malnutrition. And then we have the characteristics on the left: weight loss, energy intake, body fat, muscle mass, fluid accumulation, and grip strength. So all these factors are considered when we want to really understand the criteria for malnutrition, right? For example, body fat, moderate depletion in the acute illness injury, right? Severe depletion of body fat is going to be in the chronic disease related. And then in the social or environmental related malnutrition, also severe depletion. So take a look this and analyze, right? Edema, remember that edema is related to low protein, and therefore you're going to have fluid accumulation, right? um, and that is also lack of albumin. Characteristics to diagnose moderate malnutrition, right? You have mild depletion of body fat in the acute illness and fluid accumulation that is mild, for example, in social or environmental related malnutrition. So protein energy, malnutrition after surgery. This particular paragraph is good to know, is NCLEX alert. Let me review again the title: protein energy malnutrition after surgery. So malnutrition compromises quality of life and the ability to recover from surgery and injury, and is related to protein, right? And we know protein has the 9 amino acids that are essential for the life. So especially in older people, usually oral supplements or enteral feedings for malnourished patients before surgery improve clinical outcomes such as reducing infection and preventing unintentional weight loss. And planned weight loss is indicative of malnutrition as well as of the inability to deal with psychological stress. So malnutrition is not only related to the weight loss factor, but also the psychological stress, right? Because remember, the second brain in the body is the gastrointestinal system. So why? Because the gastrointestinal has almost the same amount of nerves. Okay, so whenever we have malnutrition or malabsorption or problems with digestion or any gastrointestinal issue, our brain is gonna sense that, and we're gonna have depression, anxiety, memory problems. Okay, that's why the psychological stress is highly related to the malnutrition. The Academy of Nutrition and Dietetics defines moderate malnutrition as an unintentional weight loss of up to 5% over 1 month period. This is NCLEX alert. 5% over a month period or 10% over a 6 month period. So you see your grandma or your neighborhood is losing weight approximately 5% in 1 month, unintentional, something is going on, right? Or maybe 10% within 6 month period, something is going on. Okay, unintentional weight loss beyond these amounts is diagnosis for severe malnutrition and requires, in my opinion, a visit to the gastroenterology. Something could be going on there. Okay, especially cancer, which is one of the main reasons. Okay, so energy. Sufficient energy intake spares protein for its tissue building function. When energy is not readily available, the body sacrifices protein for its kilocalories. Okay, so let's review this again. Sufficient energy intake spares protein for its tissue building function. When energy is not available, the body sacrifices protein for its kilocalories. It's going to take proteins for energy. thus providing adequate energy from carbs and fats is necessary when clients need protein to build and repair tissue. And here I want to address the ketogenic diet. It's very popular right now. People are eating a lot of proteins, but they are not getting enough carbs and fats. Well, they get some fats through the protein, right? And probably your specific oils, but they are not eating the carbs, so the body is getting the energy from the proteins they are eating, but also the body is absorbing more energy, are metabolizing more energy that is stored, that is already stored. So this ketogenic diet is not for everybody. Okay, you need to go to the doctor and get authorization. Basically, first you need to be evaluated, and then you get kind of authorized to follow that ketogenic diet. Micronutrients. We have our vitamins and minerals. We spoke about that before in the previous chapters. Macronutrients are your protein, carbs, and fats, and your micro are your vitamins and minerals, right? B complex, especially your B complex vitamins. The healthcare team must identify and correct any nutrient deficiencies like iron, or electrolyte and water imbalance before surgery. When I say electrolytes, we are talking about calcium, magnesium, your potassium, your sodium, right? But it's very important to check your micronutrients, especially B, because they are related to the nervous system, right? Immediate preoperative periods, nothing is taken orally for at least 8 hours before the procedure. You're being MPO, and this is NCLEX alert, right? Nothing per oral, MPO. This protocol ensures that the stomach does not retain food during surgery. Yes, because the presence of food may cause complications such as aspirating food particles during anesthesia or vomiting in the course of recovery from anesthesia. That's why you need to be MPO before any procedure. The healthcare team often recommends fiber-restricted diets for several days before GI surgery, okay? To clear the surgical site of any food residue. And we need to remember that fiber is high residue diet, okay? So that's why they recommend fiber restricted diets, okay? Commercial elemental formulas that are free of residue can supply a complete diet in liquid form, okay? Clients can drink these formulas or take them through an enteral feeding tube. We're getting there. We are getting there. We're going to explain the enteral and the parental. Emergency surgery. When surgery is urgent, there's no time to maximize nutrition reserves, right? In the case of a trauma, a car accident, gun shooting. So post-operative nutrition care, nutrients needs for healing. Clients may experience diminished or a complete lack of food intake for a period after surgery, okay? If clients are not able to resume adequate oral intake within a few days, the healthcare team may consider an alternative form of nutrition support. Here we go. Protein. Immediately after major surgery, for example, a trauma, right? Related to any accident, any, for example, open heart surgery, right? The body tissues may undergo considerable catabolism, okay? And it's very important to know the difference between catabolism and anabolism, okay, which means that the process of tissue breakdown and loss exceeds the process of tissue buildup. Tissue buildup is anabolism. When we cut the tissue, that's the way I remember catabolism starts with a C. So it means that we are cutting tissue. We are breaking down tissue. We're cutting tissue, that's catabolism. And when we build up tissue, it's anabolism. Weight loss and malnutrition are common among patients who are experiencing catabolic stress, right? Because that rate is higher than anabolism. The maintenance of lean body mass improves the outcomes for some catabolic patients. So in addition to protein losses from the breakdown of tissue, right, other losses of protein from the body may occur. These losses include plasma protein, which is rich in a lot of nutrients because of the hemorrhage, blood loss, and various body fluids or exudates. So we are losing protein because of excessive catabolism, and also we are losing plasma proteins that are rich in a lot of nutrients, right? So I just want to review the term residue: any undigested or unabsorbed food remaining in the colon after digestion has taken place. So that undigested or unabsorbed food remaining in the colon, when we say the colon, we are referring to the large colon. It's not the small intestine, okay? After digestion, right? So includes fiber and substances that stimulate contraction of the GI tract. Okay, so let's continue. If any degree of prior malnutrition or chronic infection exists, a state of protein deficiency may contribute to significant clinical complications. Problems could be like poor wound healing, and that's something that we need to avoid. The rupture of the suture lines, dehiscence, okay? There are patients that are post-operative and they are not having enough protein or good nutrition, or probably they were not prepared appropriately before the surgery. Or it could be also that the surgeon did not suture the wound properly. So now the wound is open, okay? That is called dehiscence. The delayed healing of fractures, depressed heart and lung functions, anemia, the failure of GI stomas. Stomas are opening in the bowels, right? And sometimes they are helpful for patients that are recovering from anastomosis, bowel resections, patients that are having Crohn's, or they had a resection from the colon due to cancer, etc. We're going to review the stomachs later. So a reduced resistance to infection, liver damage, extensive weight loss, muscle wasting, and an increased mortality risk. So here in table 22, we have the fiber restricted diet, food type, for example, dairy, right? Foods that are not allowed, whole milk, half and a half. So these are restricted, fiber restricted diet. Grains, for example, whole grains, popcorn, fruit, raw fruits, dry fruits, prune juice. These are because these fruits are high in fiber. So when we are going to have these types of surgery, we need to put the patient on a fiber restricted diet. They need to avoid these vegetables, raw or uncooked, right? Fats and oil, for example, your coconut and avocado. This is a good way to start learning little by little our diets, which one are fiber restricted, which one are low residue. Little by little, by topic, you keep adding knowledge. Okay, you don't need to learn everything by memory in one shot. So building tissue depends on adequate amount of essential amino acids. As we spoke, we need 9. During wound healing, a client dietary protein needs increase beyond normal to restore lost protein and to build new tissue at the wound site. So after surgery, we need extra protein, right? For normal consumption and for healing. And protein and minerals are essential to the foundation of bone tissue and for proper bone formation and healing. And that's good to know. NCLEX alert. Protein supplies the matrix for calcium and phosphorus, which strong bones require. NCLEX alert. Okay, our bones are going to produce good cells, RBCs, your WBCs, your platelets, okay? And those cells are going also to help with the healing of the tissue besides the protein, right? But we need especially calcium and phosphorus to make our bones strength. Therefore, they can produce good RBC, WBC, and platelets, okay? Controlling edema and shock, an adequate supply of the plasma protein albumin is necessary to maintain blood volume. We spoke in class also. Albumin coming from protein is very important. It's a magneto for fluid. So patients are not having enough protein, they are going to have edema in the lower extremities or anywhere where the infection is, right? When a client albumin level drops, pressure to keep tissue fluid circulating between the capillaries and cells is insufficient. Without adequate pressure, capillaries lose water, which results in edema. That's the technical explanation. Edema is the swelling of tissue from excess fluid that does not return to circulation. So it's going to stay in the extracellular space. So we need the intracellular, okay, to keep the fluid in that area. Generalized edema may adversely affect the heart and lung function, of course, because this fluid is going out of the circulatory system and is right now in the extracellular, in that space. So that's why the heart is going to start maybe pumping faster. We're going to have a patient with hypovolemia, or maybe the patient is going to be in shock, right, because of the volume. Local edema at the wound site interferes with the closure of the wound and hinders the healing process. Excessive loss of blood from circulation because of low albumin level and subsequent edema may lead to symptoms of shock as the body attempts to restore euvolemia. So hypovolemia is low blood volume, the one that I just mentioned, and euvolemia is the normal blood volume. So we are looking for a patient, we need to have the patient under the euvolemic state. Okay, and we need to prevent hypovolemia. How do we prevent hypovolemia? With good amount of protein. Therefore, albumin is going to be in the normal levels. It's going to be the magneto to keep the fluid in the circulatory. Therefore, the heart and the lungs are not going to suffer. That's the summary. Resisting infection. Protein is the major component of the body's immune system. The immune system defensive agents include specialized white cells called lymphocytes, as well as antibodies and various other blood cells, hormones, and enzymes. A strong body tissue provides a major defense barrier against infection, and that's good to know too. Transporting lipids. Fat is another vital component of tissue structure, fat, right? It forms the lipid bilayer of cell membranes. So every cell has in the outside a bilayer. Okay, it's a membrane, it's a bilayer, a membrane, and this is composed of lipids, and it takes part in many other metabolic activities. Protein is necessary to transport fat through circulation to all tissues and to the liver for metabolism. Example, lipoproteins. So something that I want you to remember is that we have some vitamins that are fat, that are fat soluble vitamins, your A, D, E, and K, okay? Your ADEC, that's the acronym that I use. ADEC vitamins are your fat soluble vitamins, okay? So when we talk about the cells and how to promote a healing or good health, you always remember the bilayer of the cells, right? That are having this lipid bilayer, right? And you can relate it to the vitamin A, vitamin D as in David, E, and vitamin K. Okay, energy. When the body needs to build tissue, we must supply it with adequate amount of kilocalories from carbs and fat in order to spare protein for this vital function. In situation of acute metabolic stress with extensive surgery or burns, right? We have acute metabolic stress. So the body is metabolizing like crazy at very high speeds because right now we are having a surgery. We need to provide protein to that particular location or the patient suffer a burn. So right now we need to replace the tissue. That's why it's this high acute metabolic stress. Energy needs may increase to as much as 1.2 to 2 kilocalories per kilogram of body weight per day over basal energy requirements. And remember that basal energy expenditure is important that we consider. I have I am providing you with a table here, basal energy expenditure. There is a calculator here that I gave you a website, right? So you can put the age of the patient, the gender, the height, the weight, right? To calculate how much is the basal energy expenditure, right? Let's say a female that is 52 years old, the height is 5'8", the weight is, let's say 165, is sedentary, no stress, temperature is normal. So this is the result. You need 1,447 kilocalories per day, and total energy expenditure is 2214. Okay, so this is helpful to know. It's very important to know. So let's see. Okay, let's go back to this. So I gave you the Omni calculator for your best use instead of remembering formula. I understand the nutritionist is going to go over this, but we can have this application in the cell phone. The clinical dietitian carefully estimates energy requirements in surgical patients to prevent overfeeding, which is associated with several complications. So water. Fluid replacement is necessary to prevent dehydration, maintaining circulation, and reduce complications. During the postoperative periods, large water losses may occur from vomiting, you see, hemorrhage, fever. Fever is critical. You cannot believe how much water, how much fluid we are losing through fever. That's why whenever we see a patient that is having high temperature, it's an emergency. Okay, remember that the brain is swimming in a box, let's say on a bed of fluid. So when we are having fever, we are compromising many functions in the body because the brain, the master, right, the director of the orchestra, is suffering, is losing the bed of fluid. Okay, so fever is a no-no. Infection or diuresis, meaning a lot of urine, right? Vitamins. For example, vitamin C is vital for building connective tissue and capillary walls during the healing process. Yet vitamin C levels may be low, particularly in critically ill, malnourished individuals. So here there is a reminder about some concepts: dehiscence, stoma, eubulimia, sepsis, and diuresis. Probably sepsis, I didn't mention it, is a life-threatening immune response to a bacterial infection. In other words, also well known as septicemia, right? That's good to know. Master these concepts when in clinical doctors will provide report with this terminology? Yes, because when you're going to be doing your clinicals at 7 a.m., the doctor is making rounds and is going to mention patient in 200 is having a stoma, the situation is under hypovolemia, septicemia could be present, la 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 la. So you need to master this terminology, okay? Microvascular function and helps to decrease the length of hospital stay. That's important. Vitamin C for microvascular function. Additionally, vitamin C and thiamine, which is a form of vitamin B, combined with certain medications may be particularly beneficial for critical ill patients with sepsis. Okay. So supplementation with various combination of antioxidants and polyunsaturated fatty acids shows promise in preventing post-surgical complications such as arrhythmias, oxidative stress, and inflammation. Polyunsaturated fatty acids. These unsaturated fatty acids, remember your bilayer of lipids in the cell membrane. So the best quality of fatty, which is polyunsaturated, okay, the best opportunity for the patient to heal that membrane. Remember, the cells is part of a tissue, so we need multiple millions of cells to heal, and the membranes they need the best of the fatty acids. Okay, so everything starts to make sense right now. We start thinking and trying to visualize what's going on during a recovery state. Among malnourished individuals with pressure ulcers, supplementation with antioxidants, arginine, and zinc specifically improves the healing of wounds. So now we're learning something else. Besides the other vitamins we mentioned before, now zinc. Okay, when energy and protein needs increase, the B vitamins that have important coenzyme roles in protein and energy metabolism, like thiamine, which is a vitamin B, riboflavin, another vitamin B, niacin, another vitamin B, should increase as well. Other B vitamins like folate, which is your B9, B12, pyridoxine, pantothenic acids, all those are vitamin Bs, okay, playing important roles in building hemoglobin, and thus adequate amount must be present to meet the demands of an increased body supply and general metabolic stress. And that's good to know, especially remember the role of your vitamin B. Minerals. Tissue catabolism results in the loss of potassium and phosphorus from cells. Perfect. We understand catabolism. What is it? Electrolyte imbalance of sodium and chloride also results from fluid imbalances, especially the electrolytes are present in high amount in the gastrointestinal, okay? Iron deficiency anemia, also in the gastrointestinal, may develop from blood loss or inadequate iron absorption. Individuals with critical illness of sepsis who have low levels of zinc and selenium in reaction to the inflammatory response have elevated risk for added oxidative stress and inflammation. So therefore, mortality rates are significantly lower in critical ill patients who have adequate serum levels of zinc and copper. Okay, zinc, it looks to be, as you can see, is very important, is critical, right? Zinc is also important for wound healing. However, even if clients have adequate zinc intake, surgical trauma and infection may lead to reduced serum zinc status and elevated needs. In my opinion, before going into surgery, which is elective surgery, meaning that you had the time to plan this surgery, get your blood work and your results of minerals and vitamins to see what you should be supplementing your body with. Okay, to know what I need to eat before that surgery. If I am low in zinc, let me supplement with zinc. Okay, that's why it's very important to get your levels of vitamins and minerals. Okay, we are going to stop here. When we come back, we are going to start analyzing the general dietary management.